phase of their life until they're stressed out or something changes or they've had an accident. Um, uh, you know, Lots of people now are running to do clear aligner therapy and orthodontics, but they're only addressing like the aesthetics. They're not necessarily addressing the muscular issues or the neuromuscular issues that are um,
Welcome back to part 2 with Karen Ann Gordon, Dr. Karen Ann Gordon, from hygiene to chiropractor over the pandemic and now public speaking and teaching, focusing specifically on the connection between TMD pain, dental hygiene, and how you can relieve that with chiropractic medicine. You mentioned something in our last episode that you were really drawn towards relief that was non-medicated. Is that the term that you
mhm.
used?
Yes, non-pharmacological.
Non-pharmacological. Okay. So I have a few questions about TM. Do you call it TMD or TMJ pain?
Really, I really like TMD because
Me
it's
too.
temporomandibular dysfunction. TMJ
Disorders
is
and
just,
dysfunction. It's a
yeah,
joint. We all have
it's
them. There's two.
yeah,
Great.
yeah.
I don't you
So
just love it when a patient comes in, they're like, I have TMD. It's like, oh my God, I have two of them. No way. We're
like
the
we all have
same.
it. We have the joint right here, right here. I have
Yeah.
that as a
Yeah.
TikTok, like
Look,
right here.
look at mine. It moves. Yeah. So,
So
okay.
yes.
So these days, the TikTok world and Instagram world, people are using Botox as a measure for
Ooh.
relieving tension. Oh, she did a little grimace. Relieving tension in the jaw, specifically in the muscles related to mastocytory function, buccinator, masseters,
Mhm.
and that's becoming the quote unquote norm. I mean, I see patients come to my practice and that's the first thing they ask for. They don't talk about assessments. They don't talk about night guards. They don't talk about exercises and stretches. I'm also an oral myofunctional therapist. So we talk about tongue posture, resting position, and stretching is really important. They go straight to Botox. How do you feel about that?
I feel like we should reserve anything pharmacological for like the last resort. There are 1,000 things that actually contribute to TMD. We really should call it temporomandibular joint syndrome because it's a syndrome. It's not
Hmm.
just one thing. Running straight to just shoot me up, Scotty, is not gonna solve the problem. Botox is a neurotoxin. You're going to bathe the area, of course, bathe the trigeminal nerve. And it
Okay.
doesn't necessarily mean that you're going to solve the underlying issue. I really feel like when it comes to Botox or injectables, you're
Yeah.
just not necessarily solving the underlying issue. You're going to always end up with that
Yeah.
problem. You're going to always end
Exactly.
up with some kind of issue. So, and then one of the things that I like to talk about with my patients, even from a neuromusculoskeletal perspective, is you have to look at things from behavior. As hygienists, we understand that if you keep doing the same things over and over and over again, and you don't change behavior, then you're gonna have the same problem.
The consensus is don't jump to conclusions and get Botox immediately. Have an assessment with a professional to identify perhaps the root cause. What would you say am I on the right track with that?
Definitely.
Cool.
Finding out what the root cause is definitely the best way to create a best treatment plan for your patient. If you don't
Amazing.
exactly understand what's going on with the patient, then we'll never solve the problem. It's just going to be a reoccurring problem for this patient.
Yeah. So, what would you say you're seeing as most common, or are there any most common root causes these days? What silly question that everyone asks is what causes clenching and grinding?
It could be a whole host of things. I think the biggest contributing factor to clenching and grinding is how people deal with stress. Stress is a big
Hmm.
contributing factor to how a person processes like stuff. Most people clench and grind and they don't even know they're doing it. If you're a high level thinker or you're under stress, you might be clenching your teeth together. You might be grinding your teeth as you're sleeping. It might be due to muscular imbalance. It might be due to the fact that you have poor occlusion. Could be head and neck muscular imbalance. It could be your pelvis, right?
Your
Like anything.
pelvis.
Oh my
How
goodness.
what
Yes, it
does
could be your
your
pelvis.
pelvis have to do with your pelvis is
Your
not
T
here, right?
right,
Anatomically, your
right.
pelvis is so what is the
Exactly.
how?
So the fascia, there's this fascia,
Yeah.
this extra tissue that extends from the tongue all the way to the tissue that connects us at the pelvis. So what
Wow.
we can see, research has shown that we can actually see that when the pelvis is off or there's any pelvic function, um, we also have a uh, misalignment or misalignment in the jaw joint, in the TMJ
Huh.
joint. And what we'll also see is that it's will be on the same side, right? And we'll also see that you know if it's like walking and chewing, right? It's how we have to walk. We can walking and chewing is a coordinated effort. So our
Hmm.
jaw kind of
Can I
mimics
walk
our
and chew? I think
pelvis.
I can walk and chew.
We can walk and chew, but it takes a lot of
Yeah.
coordination to walk and chew, right? So
Huh.
walking and chewing takes high level of coordination. We have to coordinate our jaw. Similarly, we have to coordinate how our pelvis does that, kind of like that figure eight motion. So
Interesting.
um, a lot of the similarities that we see are muscular imbalances, and that's how we kind of connect the TMJ joint and the pelvis.
Hmm.
Sometimes when we work on the whole body, musculoskeletally, then we're able to address the um, the muscular imbalances at the head and neck level that affect the
Hmm.
TMJ joint.
Interesting. During COVID and immediately post, when we returned to dental practices, everyone
Hmm.
saw a spike in patients that were clenching and grinding. And there's a direct correlation to pharmaceuticals, specifically SSRIs, claiming that it increases the likelihood of people clenching and grinding their teeth. Do you agree with that? Is that something that you've seen or researched or learned about in school?
So that's something I'd have to do a little bit more research on. It's definitely not implausible. I mean,
Yeah.
a lot of the things that we don't necessarily
There's a
actively
side
think
effect to
about.
everything, right? Yeah.
Exactly. Muscle twitching or muscle firing can definitely be affected by the SSRI uptake. Um, but I have to research the mechanisms on that. In school, we don't necessarily learn that in school. We'd have to do more research
Hmm.
on that. That's something that needs specializing, but it's not implausible. A lot of things
Sure.
that people are on a whole bunch of medications and they cause tremors. They cause an effect in the brain at the
Yep.
brain stem level. They cause uh, us to have more, I would want to call it nervous tics. Um,
Hmm.
they influence how the thalamus works, the hypothalamus works, how the cerebrum works, how the cerebellum works. So, it's not implausible that maybe SSRI might be a contributing factor to patients grinding more. I'm sure if I
Hmm.
were to do some study, I would find that there's a great correlation.
Yeah. I mean, it was highly published in dental magazines and dental literature, so I'm sure you'll find something. But I find it fascinating that you are kind of this bridge between medicine, chiropractic medicine, and dentistry, because I know oftentimes as hygienists, we feel that we're not part of that allied healthcare team. We're kind of missing in the connection and in the communication. Like, for example, I'm not allowed to really send a referral to a specialist as a hygienist. It's not really within our quote unquote scope of practice. So I find it really interesting that you're there advocating not only on the chiropractic side, but also for the hygienists. Do you find that you get a lot of referrals from hygienists and dentists specifically for this niche that you're in?
Well, mostly from dentists, uh, because some of the stuff, there's one dentist that is very good here in Palm Beach that works specifically on TMJ. And one of the things he likes is for someone to work on the fascia, the musculature around the head and neck, because he understands that when the tissue is, um, they're hypertonic, it affects the way in which the patient uh, jaw behaves, especially when he needs to do diagnostic work, or he needs to
Hmm.
create like an orthotic just for that patient. If their jaw is, their tissues are imbalanced, it's not going to give them the best result for their orthotic. So that's some of the things that you know people would refer to me. Not very many people refer to the chiropractor. You kind of have to seek out your patient, but in the
Yeah.
dental community, because I'm connected in the dental community tends to refer over to me um,
Wow.
for chiropractic
Interesting.
treatment. Hmm.
What does that assessment look like? Like if someone were to come into you, me, I have jaw pain I have had for my entire life. I've had ortho because of it. What does that first visit? I think it's also linked to this like nerve. I have a bulge disc in C3, C4, and a pinch in my brachial plexus, which used to cause tingling and numbness down my fingers. So I think it's all interconnected. What would that first visit look like with you if I flew to Lou, we're going to Florida. I'm packing up the poodle. We're coming to stay over at your place. What would that visit look like?
Definitely we do a postural assessment. First we
As I
do
sit up
before we
nice
do
and tall?
anything. No, you don't
Yeah.
have to. You sit the most comfortable position possible.
Oh, hunched
That's how I
forward.
anything
Like a
that's
dinosaur.
comfortable, yeah, anything that's comfortable to you is most natural. That's what's the
Leaning,
best
usually
posture.
leaning on
if you
something.
if you want to lean, that's fine. I'm not really hung up on being perfectly straight as an arrow. That's unrealistic.
Right.
Some so the first thing that we would do is definitely a TMJ survey, a head and neck survey, and that head and neck survey would be looking to see exactly how this particular joint pain is affecting you, and if you have an issue with the neck, then we'll do another neck survey. That information is
Mm.
vital because it helps me to understand what is it going on in your everyday life, how it affects your everyday life, and how we can create goals for you. So those are the things that would focus on first and foremost. And then we do a visual assessment. So I'll probably take a picture to see how the tissue looks, not tissue, how the face looks, the symmetry of the face, the
Yeah.
one forward facing and the one at the side, and then measure like how wide you can open. What does it look like when you're speaking? Does your jaw deviate to one side more than the other? Measure that. You're doing it right.
Am I doing it
Evaluate
right?
for, yeah, kinda, yeah. And I have my little thing that I would measure, and then we'd
Should you be able
also
to
as
if I deviate it like clicks funny. Is that normal?
I mean, you
No.
should be able to move your jaw from left to right without any popping, clicking, or pain. That
Oh.
would be normal. But then how much displacement do we have left to right from center line? And then we'd
Yeah.
also evaluate if there's crepitus, clicking, popping in the temporomandibular joint. That's how we would look at that. And then we'd also discuss not just what the jaw joint looks like, and look at the neck, and look at your
Yeah.
range of motion in your neck, and also evaluate range of motion for the lumbopelvic area to see what that looks like, and see if we have any hypertonic tissues along that area. Because I'm not just going to look only
Wow.
head and neck. I kind of want to get a full overview of what's going on.
Yeah.
After I do that evaluation, then the next thing I would do is talk about what other factors are affecting you, and what are your habits, and what is there a particular time that this pain is triggered. Really doing a real interview of what your life is like with this particular pain, and what are the other causes of the pain. Can't just look
So you're
at
kind of like
the
a
physical.
therapist also.
Kinda ish,
Because
kinda.
people are
You
gonna
know
like
what
tell you is like, okay, well, so last week my mother-in-law did this, and then the kids, the one was writing on the walls, and the other one peed in the plants, and like all of these things are happening, and then you're like, okay, so how many glasses of wine did you have? Because that is a
Definitely
contributing factor. Is
factor.
alcohol a
Definitely.
contributing factor to TMJ?
I
TMD,
don't
TMD pain.
it. I don't necessarily think it's a huge contributing factor, but if you're obviously if you're in an abusive relationship with alcohol, it can
Right.
affect how your muscles behave, right? Kind of
Yeah.
depresses everything. So I don't necessarily feel like you should stop. It does relax people. It does keep them into
Sure.
a nice, calm place. However, when it comes to like TMJ and TMD, um, I think of it as a syndrome. So if I'm
Yeah.
talking to you and I figure out that okay, well, you really have a deep underlying issue with like substance abuse, for
Yeah.
example, you may need to see a psychotherapist because that's
Yeah.
the person that will help you as you're going through your your treatment. You kind of need a
Yeah.
team to treat one person with temporomandibular dysfunction. It's just not
Disorders, dysfunction.
one thing and that's it. Then maybe in your everyday life you have habits that you need to change. Just like how as dental hygienists we look at what our patients are doing on a day-to-day basis with their diet, with
Yeah.
their oral hygiene habits. Same thing.
Mhm.
Are you chewing gum 24/7? You know,
Yeah.
are you constantly stressing by biting on stuff? Are you
Yeah.
a person that just has a very intense job and clenches instead of taking a breath? Stuff like
Yeah.
that. So finding each little step or little area that affects the person, then that's how that works. If I realize that this is way beyond my scope or I need additional help, definitely I would seek start working with their dentist. They may need a
Mm.
CBCT so we can look at the integrity of the disc. Um, and if it
And the
gets further than
condyle
that,
too. I mean, there's a lot of
exactly.
wear that happens. Sometimes people have what is it called? Condylar resorption, where the condyle
Yes,
itself resorbs, and then there's displacement of the jaw. And
exactly.
that in many instances, some people have arthritis that's underdiagnosed because
Exactly.
they've lived in this discomfort for so long, and unfortunately, clicking and popping and jaw joint pain, which patients often have, um, it becomes normal. It's like, oh well, my jaw's always done this, and progressively it gets worse over time until it's unbearable, and then they go to pharmaceuticals. But is there a preventative measure? Is there something that we could be doing? How young should we be starting these assessments? At what age would we say, a 13-year-old shouldn't have discomfort in their jaw joint? Like what's how do we go back? How do we revive ourselves from just allowing these symptoms to be so pronounced and constant?
When it comes to children, they have pain too, and that's some of the things that I feel like as healthcare professionals, we don't necessarily understand that okay, they have pain too, right? We have to kind
Yeah.
of be their advocates, look for the signs first. So if we have